Here's a list of my courses, and let's choose the course talking about the USMLE cases and quizzes. And let's scroll down the cases and choose, for example, this one. We have a type 1 diabetic patient who's feeling burning sensation in the skin around the left armpit. She experienced redness and small vesicles in the same area a month prior, but she never went to see a doctor, and the lesions have resolved by themselves. After examining the patient, the treating physician prescribed a medication which helped her symptoms. Soon after taking the medication, the patient's GFR was 35. And we know that the normal GFR is around 60, so whatever medication was given have definitely affected the kidneys. The question is, which of the following steps could have prevented this loss of kidney function? Let's see the key features. We know that they're type 1 diabetic patients, and these patients are more prone to kidney damage. Matter of fact, most of them have already low GFR before starting any medication. We know that she had small vesicles with redness. This looks a lot like shingles or varicella zoster infection. And the lesions are self-resolving. Again, consistent with varicella. And we know that the renal function was affected, as indicated by the low GFR. The medication which was given is almost definitely Acyclovir. And this looks a lot like Acyclovir-associated nephrotoxicity. Once we know the diagnosis, we know that Acyclovir is used to treat this condition, and we know, of course, that Acyclovir affects the kidneys. And in patients who are already renally deficient, the kidney damage is increased. So we have to watch out for kidney function, especially in these patients. The guidelines indicate that adequate fluid intake must be maintained with the use of Acyclovir, especially in renally deficient patients. So let's go back to the question. It's very straightforward if you look at it now. We have a herpes virus, Acyclovir is given, and the most common and suspected side effect is seen, which is treated simply by hydration. Use the link below to get access to the full course, including many cases and hundreds of quizzes. Everything in the course is high yield and common topics that we see frequently in the exams. Basically, we sat down and looked through a large number of question banks, quizzes, and many repeated exams. The topics we've chosen for this course are the most repeated topics, so they are very, very common. Thank you for watching.